Metropolis Healthcare is also in focus on account of the acquisition that the company has made. It's a 250 crore thereabouts acquisition that they have done. But let's try and understand better from Ameera Shah, the promoter and executive chairperson at Metropolis Healthcare, joining us on the show right now. Ameera, hi. Anisha this side. Good afternoon. Good to be speaking with you. First up, help us understand. We believe that this acquisition is going to be EPS accretive from year one itself. But what about the margin profile? Because this company was loss-making at the EBITDA level for quite a few years. What's the turnaround plan there?
So, Aisha, actually, the reason this is such a good acquisition for us, I think, is twofold. One is obviously strategically, it completely aligns with our goals to keep increasing our specialty testing. We're at 37% now. With Core, it becomes 41%, and our oncology portfolio more than doubles. But on the financial side, if this was a fully mature profit profile, this business would have been valued at 600-700 crores, right, of revenue. And obviously, one of the reasons that we're able to get it much lower is because the profit profile is not fully matured yet. In 24-25, the operational profitability should be a low single-digit EBITDA. But standalone, these single specialty diagnostic chains are not really financially in good health. This is not only in India but globally. But we are finding that when it's under a larger umbrella like Metropolis, we believe that the profitability will significantly improve. And in 4 years, it will reach the Metropolis margin profile as well. So by able to get something which is not very financially profitable today, but that we can take it there, actually means we are creating that value for our shareholders within our organization, where we are able to get a good quality asset at a better price and then be able to really manage it better and take it to a better place.
So this turnaround plan that you have for this new acquisition, say suppose what will be the cost savings that will firstly come in, and how much of those cost savings will be because of synergy and because of your plans that you have for the company that will also lead to some additional cost savings. So if you could break that down firstly, and then what would be the payback period of this acquisition?
So, look, this will keep changing year by year. If you see in the first year in 25-26, maybe you can say about 30 to 1/3 of the profitability of the EBITDA will come through cost synergies, and maybe 66% will come because of its own growth and being able to sort of move up the profit margin as it scales. Year two, as more synergies sort of flow in, you can probably expect that closer to 40-45% of the EBITDA margin will have come because of the synergies, and 55% will still come because of itself. And that's how the margin profile will keep increasing year by year. And like I said, in 4 years, get to the Metropolis margin profile as well. Payback for this deal should be fairly good. We are expecting about 6 to 7 years of EBITDA payback, if you count, and PAT payback of about 9 to 10 years. But together with this acquisition, it catapults us into the leading cancer testing chain in the country. And that we believe is a very exciting space, because cancer, unfortunately, is the fastest growing segment, disease-wise. And there's going to be a lot of diagnostics required to take care of people. And by being able to be tested early and in advance, you're able to catch it early and actually treat early.
Okay. Well, ma'am, this is Varun this side. If you can take us through the growth that you're anticipating in Core's business, because in last from FY22 to 24, they have grown by around 22%. So what kind of growth are you anticipating for Core? And also, would this growth be driven by volume or by pricing?
So I think we would continue to look at about the same 22% odd kind of a CAGR going forward as well. Unorganized businesses like Core and others, focus a lot on top line, not necessarily with the same level of governance that a public company focuses on. And as we come in as a public company, we tighten the governance there, and that may decrease the growth a couple of percentages. But then with the revenue synergies, we believe back at 22% should be a fair number going forward. And your second question was around?
For pricing.
Yeah, so you said volume and pricing. Yes. Look, it's not that we are seeing pricing increases in the segment, because you have to remember that specialized tests, as they first get introduced, actually tend to be difficult to afford for most Indians, because insurance is not covering it OPD out of hospital, and therefore people have to pay from their own pocket. And as we keep making these tests more affordable, you find actually the volumes go up. So if you see in the last 10 odd years, the prices for these tests actually would have come down and volumes would have gone up. And we can see the pricing now stabilizing. So going forward, really the growth will come mostly out of volumes. but also out of moving up the value chain. Because along with each prescription, while you may get 1 or 2 cancer tests, but you'll also get other tests for that patient, which may be routine tests, which is why the average revenue per patient comes to about 2,300 for core, which is a weighted average sort of between the routine tests and the specialized tests. The specialized tests alone would probably be a little bit higher.
Okay, well, if you can take us to what is the overall size of oncology business, because what we are hearing it's around 4 to 5,000 crores, and what will be the market share currently for Core and Metropolis, and going ahead, what kind of market share are you eyeing?
So currently there are only about 8-9 players in the country who are offering the super specialized, cancer testing. And half of these are chains like us and our peers, and half of them are standalone centers like Core. Overall, you're right, the market size is about 4 to 5,000 crores, and that is for the basic entry level oncology tests to the super specialized oncology tests. And obviously with Metropolis and Core, we'll now cover the entire range end to end. Really this area is going to continue to see a lot more diagnostics used. And as we take this to the 750 towns that Metropolis is already present in, we'll be able to actually make these tests more available and accessible to Indians who are going to be requiring it sort of across the space. So we do expect that, volumes are going to be the primary driver, going forward as we take them to all the smaller towns of India.
And what are the cross-selling opportunities available for the company? Because, other than oncology, Core might also, because Core has, tie-ups with many of the hospitals and everything. So will there be, opportunities available for cross-selling other tests as well?
Certainly, because while Core is partnered with almost 1,200 hospitals and labs across the country, they are only currently selling the super specialty test to these hospitals. While Metropolis has a 4,000 varieties of range of tests across all specialties and therapeutic areas, and we would be able to certainly now, using the relationships with the hospitals, offer this entire menu to hospitals and labs across the country. And of course, a large amount of these are in north and east of India, which allows Metropolis to make a deeper connection with relationships with customers in these markets which have not been where we are the number 1 player. We are probably the number 3 or number 4 player in those markets, unlike West and South, where we are the number 1 player. So certainly a lot of opportunities for cross-sell, and the same way we would be able to sell the Core Diagnostics menu to all the Metropolis customers who are already working with us for the entry level and the specialized tests.
Okay. One more question I would like to ask you, that your company has said that you're not going to get into advanced radiology. Just wanted to understand how important is advanced radiology for oncology, and going ahead, will there be any plans?
See, advanced radiology is obviously quite critical for cancer. You need PET scans, you need other kinds of things as well for, to play a part in the oncology segment. And there are a fair number of players that are offering it. There's a big difference between radiology and pathology. Radiology we find not to be so scalable, because patient has to come to the center, versus in pathology, even the sample can travel, even if the patient cannot. Second, we find the financial profile of pathology and radiology to be very different, capex heavy in radiology. And third, we find the governance around the market practices to be quite challenging for a company like ours to do in radiology. So actually our preference is to stick on the pathology side and do what we're really good at, rather than becoming getting compromised and doing other kinds of things in radiology. So, I think at this point we would like to focus on pathology, and we believe there's enough opportunity to grow on the oncopathology side with Core, and the non-onco side as well.
And lastly, ma'am, before we let you go, just wanted to understand this. You are a net cash company. Post this acquisition, you might become a net debt company. Obviously, the debt is not too high on the books, so it's not a concern as of now. But just wanted to understand what is the capital expenditure plan that you have for Core, and any leverage targets that you have, any plans of getting back to net cash position, any timelines on that front?
So look, as of September, we had about 190 crores of cash on books. Obviously, as of December, it will be more, it will be much higher. And overall, we believe we can fund this acquisition from internal accruals. But if we decide to do any more M&A, then obviously we also have the ability to use some of the debt on our books. We have zero debt at this point of time, or we could also continue to use stock as currency. So there will be many options ahead of us, and as we continue to look at a deep funnel for M&A over the next few years, we would like to leverage our cash, debt, and stock position to be able to continue to do deals. So, honestly, even if we were to take any small amount of debt, frankly, the paybacks we're talking about are 1 year to 2 years. So it's nothing significant. And obviously, with the sort of AA rating that we have, we fairly get, fairly good terms as well.
Well, thank you, ma'am. Thank you for joining us and giving us those details about this acquisition.
If you like this video, then like, share and subscribe to ET Now.